Before entering the room, I will check the more and the provider's orders. We're going to check the morphine vial against the MOR and against my orders as well, making sure it is not expired and that the vial is clean and there's no cracks in it, and then I will enter the room. So I will not provide privacy. Hi, my name's Alondra and I'm going to be your nurse today. Can I have your name, age, and date of birth, please? Okay, Miss Minnie. So today we're going to be doing an IV. We're going to start one and discontinue it. We're going to give you morphine through the IV, and then we're going to change your dressing and get a blood draw from the CVAT as well as from your arm. Is that okay, Miss Minnie? Yes? Okay. Do you have any allergies? No? Do you have any pain? From a scale of 0 to 10, 0 being no pain, and 10 being the worst pain ever. 0. So we're going to raise your bed up, Miss Minnie. Is that okay? Okay. So we're going to start with the blood. So I'll put this on you. I'm going to feel for one, feel for a vein. Okay, we're going to use that one. So I'll disconnect it and wash my hands. I'm going to put on gloves. Okay, so then I will prepare everything I need. So I'll connect this to the butterfly. We have our file. Okay, we're ready to begin. So I'm going to tighten it up again. Okay, we're going to clean the area in circles, letting it air dry. Once it's air dry, we're going to get our butterfly. You're going to feel a slight pinch, okay, Miss Minnie? Okay. In she goes. Okay, I have blood, so I'm going to grab that. Let's remain disconnected. And once I get enough blood, disconnect it from the vial, put that to the side, get a piece of gauze, and we're going to pull the butterfly, making sure the tip is intact, and we'll throw it away while maintaining the gauze there for any bleeding. So while the gauze is there, I would put my initials, the date, the time, and the patient's name. I would confirm with the patient that it is his name, her name, and then I would put it in a biohazard bag and send it down to the lab. Then I will take the gauze off, make sure there's no excessive bleeding, and there's not. Okay. So then I'll take the gloves off. Wash my hands, put on new clean gloves. Are you still fine, Miss Minnie? Yes? Okay. So now we're going to be starting your IV. Is that okay? Yes? Okay. So I have to get everything ready. I have my needle right here. Okay. I'm going to prep this tubing, making sure there's no bubbles in it. We're going to unclamp if it's clamped. set it to the side. Loosen that up a bit. Set it to the side. Open this patch. Also going to set it to the side. Okay. We have the tape already. Okay. Now we can start. So tie it. Find the vein. Found it. I would clean it. Circles, throw it away. And once it's dry, I can insert the needle. Okay, and I have return. So I'll disconnect it, throw that away. Connect it, making sure not to pull on it. Anything. Okay, and then we can go ahead and advance it a little bit more. So I'm going to pull back, check for blood return. Do have it. Okay, and then we are going to insert some saline. Okay, I'm going to clamp it. Okay, and while holding that there, we're going to grab this part. Okay, we'll put it there. It's nice and ready. And then we can continue injecting the saline. And clamping it. Okay. Disconnect this. Throw it away. We're going to put my initials, the date, and the gauge used. Then we're going to put the label right here. Okay. And now we can hold this to there. Put tape to make sure that it's not hanging just loose on the skin. Okay, and then we can take off our gloves if they are soiled. So let me take off my gloves. And I'm going to wash my hands and put on new gloves. Forgot to take that off, but I would take it off once I have inserted the needle in and I saw some blood return. So now I will compare the vial name with the band on there, and I will tell Miss Minnie the 7 rights. So it'd be right patient, right dose, right medication, right administration, right documentation. It was right route. So instead of right administration, it'd be right route, and then it'd be right dosage and right time. making sure that they do want it and that they know the side effects, which are dizziness, headache, stomach cramps. Okay, Miss Minnie, is that okay? Yes? Okay. So on the order, they want 0.2 milligrams. So we're gonna get a alcohol swab, clean the top of it, needle out, 2 milligrams of air, inject the air, and we're gonna get show the camera. Okay, it's 2 milligrams, and then I would have another nurse watch me dispose of this medication. Put that away. Okay, and then I would clean the port, connect medication, unclamp the tube, and we're going to give it for 4 to 5 minutes, very slowly, making sure the patient doesn't feel any pain. Are you feeling any pain, Miss Minnie? No? Okay. For the sake of this video, I'm going to go a little faster so that it doesn't take that much time, but it would be from 4 to 5 minutes. Stopping if they feel any pain or burning sensation. Okay, I will clamp it again. Disconnect the tubing. Throw that away. We're gonna get saline. Again, 5 milliliters. We're clean the port. Once it's clean, connect. And I would also push the saline from 4 to 5 minutes with the medication. So I would unlock it, would give it 4 to 5 minutes. Making sure to check in with the patient as well, making sure they're all right. Okay, once we're there, we will disconnect it, throw that away. Now we could start with the process. I could change my gloves off and wash my hands and put new gloves on if they were soiled. So now we're gonna get rid of the IV. So using an adhesive remover and alcohol wipe, we're going to remove the tape, making sure it's not pulling against them. The IV tubing would be clamped as well. Throw that away. Sticking to my gloves. Okay, there we go. So I pull towards the middle. Using an alcohol pad so that it doesn't pull the skin too much, doesn't cause any pain for the patient. Okay, we're going to put swab underneath, putting pressure, and we're going to pull. Okay, hold it out, we're going to dispose of it. Correct container. Okay, holding the swab there. There we go. Going to continue monitoring it for any excess bleeding, irritation, swelling, inflammation as well. So we're going to move this away. We could start with the CVAP dressing. Take off my gloves, dispose of them, and wash my hands. Okay, we could start with the CVAD. It's a sterile procedure, Miss Minnie, so we're going to need you to not move that much as it can break sterile fields. Okay, Miss Minnie? Yes? So put on my gloves. Gonna go on my mask before. So my mask, instead of being in the sterile field, would be outside of it. And as I broke it, I would dispose of this bag and get a new dressing change back. Okay, wash my hands. I'm gonna put on my mask. Have the patient put on his mask as well, or turn away from the procedure, and they chose to turn away. So I'll raise the bed to my level and lower the railing. And with an adhesive remover or with an alcohol swab, we're going to take away, making sure not to pull the skin too much to cause irritation. And pull upward. Okay. I'm going to dispose of that. I'm going to take off my gloves. Wash my hands. I'm going to open package now. Gloves out. gloves on. A little difficult. So we would measure. Measure if it moved. We would document that. And then we would clean it. Get the tweezers. We're going to grab it and lift it. Going to clean the underside too. We'll dispose of that. Okay. Get the valve. With this hand, we would put a stabilizer as well. I inspected the skin for any drainage, and there were none. There was no drainage, excess drainage. The skin was not red. It was intact. Okay. Now we can put my initials, date, and gauge on it. And put it up here. Okay. And because that is done, we can go ahead and clean the area. I'm going to take off my gloves and throw them away. I'm going to wash my hands. Now I can get rid of the mask, but I'm not. So I'm going to prepare to get the blood. Okay. Gloves. After I have washed my hands. Okay, I put on my gloves and I wash my hands already. So I can go ahead and open up everything. Prepare for it. Okay. I'm going to take off the green cap, throw that away, and we're going to I would clean the port, then I would grab one syringe, connect it, unclamp, pull back as many milliliters as the laboratory wanted, and then I would clamp it, disconnect my first syringe, I would throw that away, and then I would clean it again. Connect to my second syringe. Would pull back, once I'm clamped, I would pull back how many milliliters you wanted. Very slowly. Okay. So 5, we got the 5. I would disconnect it with the entire piece. I would give it to a lab like this. They would be in the room with me, so I would give it to them, and then they would take it down to a lab. So open this part. connect the new port to this ring. Take off the blue part. And we would clean it again. And then connect it. We would pulsate the saving into it very slowly. Okay, and once it's done, we'll disconnect the syringe, throw that away. We're going to grab one of the green caps. We're going to connect it to the port. Okay. Okay, and now we're done. Okay, I can keep the railing up. We can discard all my stuff, all my supplies. I can take off my gloves. Okay, Miss Minnie, we are done. Is there anything else I could do for you? No? Okay, so I'm going to lower your bed. So comfortable position. Give you your call light. It's over there, okay? If there's anything else I could do for you, just press your call light. So I would document, before leaving the room, I would document the length of the CVAD line and document all of my findings as well.